So together with our Chief Medical Officer, Amir Hamid, I lead the eye sciences team at Optegra. So we're a small but very impactful team, and we support the business in analysing the results and the outcomes of the surgeries and the procedures that we deliver. So we share our outcomes data both internally for quality assurance purposes, and we prepare reports for the regulator and external bodies such as the National Ophthalmology database audit. And we're delighted to say that the outcomes that we achieve compare very favourably to industry benchmark standards, but we're never complacent about our outcomes. We continually work hard with our clinicians and our industry partners to improve and refine the way that we deliver care and actually the treatments that we offer to patients. So one of the other things that the eye sciences team deliver for the business is looking to identify new innovations and new treatment types that may be appropriate to deliver to patients. So to do this, we work very closely with some strategic industry partners, as well as academics who we collaborate with from various universities. And examples of how we innovate may be ways that we increase our efficiency by upskilling some of the clinical teams within our own businesses. And some great examples of this are, working to train our nurses to deliver injections so that we can offer treatment in a more timely fashion, for example, to patients who suffer from age-related macular degeneration. Similarly, we work with very talented optometrists within the business, and over the years it's been pleasing to see that we've been able to support our optometrists training to become independent prescribers, again with the benefits to patients of being able to access treatments and medications in a much more timely fashion. We also deliver education and training to some of the optometrists that we partner with in the community. We run monthly CPD events, monthly webinars, and these are increasingly popular with our community colleagues. So we may typically get hundreds of people joining one of our monthly webinars, and we're really keen to make sure we deliver relevant and exciting CPD, so we look very carefully at the feedback after each event to continue to refine the events that we offer in future. One area that we're very excited about is our research opportunities. So over time, we've been successful in obtaining research funding, both from industry and from sources such as the EU. We've trained our own PhD and postdoc students, and our latest collaboration is funding by Innovate UK for a really exciting project in artificial intelligence. So again, this is a collaboration with some leading academics at Manchester University, and our research associate is a data scientist, and she's going to be working with Optegra and the university really closely to optimise and refine the way that we use artificial intelligence within our business. So we're very excited about that project and really pleased that we have Mariam within our business. Another member of the eye sciences team is going to be helping us to deliver more clinical trials and audit processes within the business. So again, we're excited that we are about to start a new research project looking at some of the latest innovations in intraocular lens technology. So again, I think what's delightful for me as the head of eye sciences is very recently we've strengthened the links with our sister companies in Czech Republic and Poland and Slovakia. So we are looking forward to collaborating even more closely with colleagues overseas over the coming months and years. So a really important part of what we do at Optegra is robustly review analyse and disseminate the outcomes data that we achieve across all of our sites. So a big part of what we do is delivering reports for use internally and externally. So we deliver outcomes data on the key procedures that we offer, including cataract surgery, AMD services, and our vision correction or refractive surgery processes. So examples of how we utilise that data include sitting down with the key clinical people within our hospitals on a regular basis to review in great detail the outcomes for some of the key performance indicators that we measure. And I'm delighted to say that when we look at the data that we analyse internally and that gets analysed externally independently from Optegra, the outcomes that we achieve are consistently within or better than the benchmark targets set by the industry. So one example of this is for cataract surgery. A key clinical indicator of surgical quality is the rate of posterior capsular rupture. And it's pleasing to say that whilst the industry benchmark for this measure is low, 0.8%, at Optegra we perform consistently better than that. So our posterior capsular rupture rate is 0.3, which again is much less than the accepted industry benchmark. If we think about our AMD outcomes, a key metric or measure of success is how well patients see. And when we look at the level of vision that patients achieve maybe a year after treatment starts, again, it's pleasing to see that 63% of patients are achieving 75 letters or better, whereas the industry benchmark for that measure is considerably lower at just 39%. So again, really pleasing that the outcomes that we're achieving are so much better than these targets that are set externally. So we're never complacent, and as I say, a big part of what the eye sciences team do, Nabila Jones does a lot of great work ensuring that we continually develop and refine our outcomes reporting, and we constantly look at new ways and ways that we can improve how we report and how we share that data and how we make it more accessible to not just internal reviewers or external reviewers, but actually for patients too. So again, patients quite rightly are becoming increasingly interested in understanding what good looks like in terms of healthcare. So a big area of focus for Optegra at the moment is developing sophisticated ways that we can make it easier for patients to give us patient-reported outcomes data. And again, we compare very favourably in terms of our percentage of 5-star ratings that we achieve and our percentages of patients that share with us their willingness to recommend Optegra services to patients of the future. So again, outcomes reporting, really important to us and something that we take very seriously, because patient care and patient outcomes truly are at the heart of absolutely everything that we do at Optegra.